Swadikap, good afternoon once again for today, the Friday, the 14th of January 2022, the English language summary of the press briefing here at the CCSA. First, I'll start off with the vaccination progress. Today, we inoculated 542,689 doses of vaccines, bringing the total accumulated number of vaccination to over 108 million doses already, registering 71.8% of the total population having received their first dose of vaccine, while the percentage of the population that have received their second dose stands at 65.7%. And you can see on the chart on screen right now, we've categorize this into first, second, and third dose. You can notice that the third or booster dose, more and more people are getting that third dose, which is good news. And of course, the cumulative number is way beyond 100 million doses. Not persons, I just have to repeat, but doses. And this number will continue to climb up in the days and weeks ahead. So I'll move to the general situation, number of confirmed cases and recoveries that we have for today, 8,158 new confirmed cases. Mind you that in a few weeks ago, last week, it was much less than this, of course, in the 3,000s. We have new recoveries at 3,948 cases. Active cases still being treated, 74,795 cases, with 15 new fatalities recorded for today. There had been increase in the number of new confirmed cases, while the fatality rate remains at 1%. This is especially true for this latest wave for the Omicron variant. Well, we're in home isolation with close monitoring and evaluation by competent health authorities via telemedicine. Telemedicine remains the main treatment method for those infected. And as a side note, some of the fatalities registered today did not receive any vaccination. They were not vaccinated against COVID-19. So it bears repeating, therefore, of the importance of vaccination for the fight against COVID. So each and every one of us should get vaccinated as soon as possible when called upon to do so and when you have the opportunity. So I'd just like to reiterate once again about Thailand Pass on one important issue, that there is no registration fee for Thailand Pass. Because there had been reports of people who had been asked illegally to pay registration fees when they had asked agencies or other people to register on the Thailand Pass on their behalf. We wish to affirm that there is no registration fee for Thailand Pass. It is a service rendered free of charge for those wishing to enter Thailand. So if there is any agent or middleman or any sort of entity offering that, it bears repeating that the registration for the Test and Go scheme is suspended indefinitely for new registrations. So those with duly approved QR codes prior under the scheme may still enter the country as per the approved schedule. Those wishing to enter the country now would have to register to enter through the sandbox scheme only or the alternative quarantine scheme only. And for those coming into the alternative quarantine scheme, the quarantine period reduced from 7 days for fully vaccinated persons and 10 days for vaccinated persons had been reduced to 7 days for fully vaccinated persons, and for unvaccinated persons it is 10 days. So just a little piece of information about pandemic and endemic as we hopefully transition to an endemic in Thailand, as we prepare for that in Thailand. We're entering the 5th wave of the COVID outbreak in Thailand. And public health authorities have announced their plan to effectively manage the outbreak in the country to an endemic by delaying its spread and switching to the use of antigen test kits or the frontline screening method, the ATKs as the frontline screening method. So Public Health Permanent Secretary Kittipoom Wongrajit said that Thailand had entered the third year of its fight against COVID, and which was initially predicted to be dealt with and contained in manners similar to bird flu and SARS. The virus has since developed into a pandemic, global pandemic, of course, with recurring outbreaks, and Thailand had experienced large numbers of outbreaks from May to August of 2021. Dr. Kirtipum said that since then, the vaccination progress in the country had made great strides, enabling the country to reopen to tourists, as Thailand planned, to coexist with COVID-19, and to allow the economy to move ahead, that important balance. New infections have been dropping since until the start of 2022, when the current wave of the fifth wave of infection took hold. So public health authorities will be managing this wave of infections in ways that enable COVID to transition into an endemic, meaning more localized, as more and more people develop immunity. So the Department of Medical Sciences Director General said that COVID-19 is mostly not found to be causing severe symptoms, but transmission is occurring at a more rapid pace in Thailand. This necessitates a shift of the disease screening method from the time-consuming and more expensive RT-PCR test to the antigen test kit, or the ATK method, in order for resources to be better utilized. The Director General explained that individuals suspected of being infected will be tested via the ATK method and entered into home isolation or community isolation. If they test positive and display mild or no symptoms of COVID, if symptoms increase, the RT-PCR test method will be applied and individuals will enter into the appropriate treatment process. While those testing negative, but with a history of exposure to the virus, are to self-quarantine and take the ATK test every 3 days, or every 2 days after the latest test if symptoms become more severe. I have information regarding the vaccine management policy in terms of the cross use of vaccines, different types of vaccines, wherein the Ministry of Public Health has issued official guidelines for COVID-19 vaccine management policy and vaccination recommendations as per the infographic shown on the screen right now. A quick rundown of the vaccine cocktails recommended by the Ministry of Public Health. Firstly, for those who have never received vaccination, those over the age of 18 should receive 2 doses of AstraZeneca, 1 dose of AstraZeneca. For those over the age of 18 should receive 2 doses of AstraZeneca, 1 dose of AstraZeneca and another dose of Pfizer, or 1 dose of Sinovac and another dose of AstraZeneca. Those from the age of 12 to 17 receiving 2 doses of Pfizer. But details, of course, you can find that on the page that is shown on screen and from the social media accounts of the Ministry of Public Health. Now, for Pfizer vaccine for children, a bit of good news for parents who are waiting for the Pfizer vaccine for children in Thailand. The Disease Control Department said that Thailand is one of the first countries in the regions slated to receive the Pfizer vaccine, specifically made for children. Once the vaccine arrives, the department will start distributing it for children across the school-based system. And in this early phase, children aged 9 to 11 will be the first group to receive. The vaccine is earmarked for children between 5 and 11. And the Pfizer's vaccine for children is different from the adult version. Of course, children only need 10 micrograms per dose, while adults need 30 micrograms per dose. The normal vaccine for adults cannot be divided into 3 doses and used in children. Additionally, the Food and Drug Administration is also registering inactivated vaccines, Sinovac and Sinopharm, to be used in children. After the National Vaccine Institute's Immunity Promotion Subcommittee grants the approval for the inactivated vaccines mentioned, parents will be able to choose the vaccines to use for their children. Before closing, I'd just like to mention that Dr. Apisamai mentioned there was a query about Pfizer, about RT-PCR, whether it's required or not before arriving or coming to Thailand for Thai nationals and foreign nationals. And there's an infographic there. I'll just explain it briefly that it is required. There was some question, some doubt whether the regulation required it or not. And just to confirm that it is required, RT-PCR required 72 hours before arriving into the country. So that's a requirement that is for people who are coming into Thailand through the sandbox and the alternative quarantine schemes. So just in closing, before we head out to the start of the weekend, remember that the fifth wave of COVID is still here with us for the time being in Thailand, urging everyone to take good care of each other and follow the DMHTTA universal prevention measures as always. We'll be back with the English language summary next week on Monday. So from all of us here at the CCSA, wish you a pleasant weekend. Thank you for your attention. สวัสดีครับ
ครับขอบพระคุณนะครับ